I am very excited about this panel. We're going to be talking about big tech and healthcare and the challenges and opportunities that big tech companies are having navigating the healthcare system. I'm going to turn it over to our moderator, Liz Rockett, Senior Advisor from Unseen Capital.
Thank you so much, Renee, and hello, everybody. Good morning. I am so delighted to be here. Just a quick word. I am, as Renee mentioned, I'm the Senior Advisor for Unseen Capital. Also recently a founder myself of a new organization called the Mission Lock Collective. So really delighted for the panel that we have. We may have one more sneaking onto stage. We've got a in high demand crew here. But I'd love for each of you to just do a quick introduction of yourselves and then we'll dive in.
Good morning, everybody. I was trying to think is it morning or afternoon, but it's morning, I guess. Still on East Coast time. So I'm Bakul Patel. I'm the Senior Director for Digital Health Strategy and Regulatory at Google. I spent about 13 years at FTA. I just joined Google about 6 months ago, so in the short.
Fantastic. Good morning, everyone. My name's Jen Goldsack. I'm the founder and CEO of the Digital Medicine Society, or DIME.
And hello, everyone. My name is David Rhew. I am the Global Chief Medical Officer for Microsoft.
Excellent. And I had an intention to ask you all to do a little introduction to give us a sense of who's in the room, but we are blinded up here with these lights. So I'm going to ask you to do something a little offbeat. Work with me. I'm going to go through just a couple categories of just understanding who's here. I want you to clap or make other noise, whatever you'd like, if you're in that category. So starting with who is here who is currently working in what you would call big tech? Don't be silent, your fellows need to hear you. Okay, wonderful, thank you. How many of you here are entrepreneurs or working for earlier stage companies? Okay, good, we've got some of you. Thank you, we really can't see you at all. And then the last that I was curious about, who here is working in healthcare in some capacity, working for a system, a plan, somewhere else in healthcare? Okay. There's our crew. Okay, wonderful.
Team healthcare.
Thank you all for doing that. Excellent. Well, I'd like just to kick us off, Jen, I'd love to start with you. Where we are today, healthcare has been on its trajectory and its work towards really bringing its digital transformation about, and it's been slow and maybe a little painful. Curious when you think about the challenges that are in front of the healthcare ecosystem to really achieve a full digital transformation, what's on your mind? What are you watching right now?
It's Liz, a great jumping off question. I won't belabor this because Team Healthcare has a strong showing, but I think for our tech colleagues it's worth pausing before we address that to say what are the challenges actually in the healthcare system writ large that we're facing today. I think we're facing rapidly escalating costs. We have a staffing crisis. We need to make every unit of clinical care go further. This is not new, but there has been a light shone on it as a result of the pandemic, which is we have terrible health inequity. And there are still many diseases out there, many cancers, Alzheimer's, Parkinson's disease, so on and so forth, that we have no disease-modifying treatment for and no cure. There's an awful lot of work we need to do. Healthcare's been working very hard on these pressing and persistent problems for a long time. And before we talk about the challenges of the digitization of healthcare, I want to say that this is just a challenging industry generally. It's an industry that's intended to care for 350 million people in the United States. It's complex, it's highly regulated. There's an interesting mechanism of actually paying for it. These are all challenges that face healthcare broadly. So then let's think about the challenges that are actually facing the digitization of healthcare. And I may be so bold as to even say it's probably the last big industry that hasn't experienced that full digital transformation. And I think what we've seen, and then keen for my colleagues to sort of pile on here, is there's been a focus on an individual point solution, right? Everyone has a product, a widget, one clinical pathway that they think is going to transform healthcare. And the sort of silly throwaway term I use sometimes is, the healthcare industry in the United States is $4.1 trillion. That's substantially bigger than the GDP of France. No one's walking into Emmanuel Macron's office saying, yo, Prez, I have an app and it's going to change France. So why do we think that's going to work in healthcare? And I think that this is the challenge. We have this really siloed, this really fragmented industry with these, competing disincentives is wrong, but competing incentives, and we haven't figured out how to create integrated solutions that actually address those challenges rather than are a temporary fix and temporarily revenue generating. And I think we have to think big picture, and I know it's overused, but we have to think about transformation instead of nibbling around the edges. Nibbling around the edges is not going to get us to where we need to go.
Okay, so a bold start for where we're starting. And
if anyone's planning on pitching Emmanuel Macron in the next few weeks, I'm sorry to disappoint you.
Let us know if it works. I think when I think about just the role that the bigger tech players have played in this digital transformation, it's been a bit of a stop-start, right? It's been a little bit over these last 15, maybe 20 years, a spark, an idea within a large company saying, I think this is how we can help, I think this is how we can be part of this, and then maybe a re-entrenchment of sort of like, ooh, let's pull back. I think back to around 2008, 2009 with personal health records and all of that. So we've had, and that was both of your organizations, preceding your Wisdom joining, were sort of the stalwarts in that. But I'm curious, when you look inside today, what's the sense of the right role for Google, for Microsoft, for the bigger technology organizations from within? What's your sense internally?
It's a great question, and I also wondered before joining Google, like why is this such a start and stop going on? And I would say I think the mission that Google currently has is, how do we make billion people healthier? And that's a phenomenal mission. So it's like going beyond the 350 million people in the US and thinking about France and India and Indonesia and other places. So what I've seen in my short time at Google is we're trying to leverage technology to enable care transformation that's going on. So if you can imagine, and we recently released this, right? So YouTube, you can just go in, at least in the US, you can search for a condition and you'll get, experiences that people had for that condition show up and being surfaced. So we are using that technology to sort of get people to be more literate, more educated, and bring information that is ubiquitously now available, but now tailoring it and bringing it in the forefront. So that's one quick example of how we are thinking about reaching with the tools we already have to the population across the globe. And then the second part is and rather than trying to create point solutions, as Jen mentioned, we're trying to figure out what can we do from a research side or, example proof of concepts, for example, AI for dermatology or AI for macular degeneration, et cetera. And how do you sort of inspire people to sort of do that? So those are the kind of things that I'm seeing that is being transformed. So to summarize, I will just say that I think the point solutions are great, but I think people are looking at their core competencies of where they can leverage what they have for what has been already done in consumer world, and then bring that to the healthcare world.
Powerful, just because how many clinicians, you all know, I was with Kaiser Permanente Ventures for about 7 years before this, and one of our perennial challenges was what do we do with all of the instinct of a patient about to become a patient, sort of a normal human, just like any of us, having a diagnosis, having something going on, and the first instinct we have is, of course, to Google it.
And we have numbers which basically shows 3 out of 4 individuals in the US actually turn to Google first to search on the symptoms before they even actually talk to somebody else.
It's interesting. So it is sort of a systemic thing that Google uniquely can do.
Yeah.
Excellent. David, I'm going to go to you next, but Han, welcome. And not to just totally bomb in on you right now, but if you could give a quick introduction to yourself to the audience, that would be great.
Sure. My apologies for being late. My name is Han Pak. I'm the head of digital health team for Samsung Electronics. Just recently transitioned into this role from Samsung Electronics America. I've known David for a while, and I'm a dermatologist and been in the Army, and my background's really in telehealth.
Thank you so much. Excellent. And I don't know how you were doing getting here, but it definitely was like three-dimensional chess for me to find this room. So we're so glad that you're here. David, just to this question of sort of how your organization is thinking today, and I know Microsoft has been on a long journey to how it partners with health systems and thinks about itself in this role. So what is that right role for Microsoft?
Yeah, so just to, first of all, following up on Han's point, I've been Chief Medical Officer, Global Chief Medical Officer for Microsoft for the past 3 years. Prior to that, I was 6 years Chief Medical Officer at Samsung, so it's a little bit of handing off the torch to Han there. But to your point, sometimes you can have the right idea, but if it's delivered at the wrong time, you won't get traction. And the concept of empowering consumers and individuals with their own health records is the right idea. The problem is that there are many barriers, and there were many barriers to delivering this as an application or a service at that time. And we are now overcoming those barriers. We're recognizing that interoperability was one of those barriers. We're recognizing that information blocking was one of those barriers. And with these newer advancements and the fact that we now have more sophisticated tools to be able to pull this information and it makes sense out of it, so we can do something more than just simply give a person access, but actually make sense of that so that they can use it. That is going to allow us to be able to create new business models that can generate opportunities. So I think the opportunities and the things that we've learned are that healthcare is complicated, as Jen had mentioned. Oftentimes we come in with a perspective very focused on what we can do. And at Microsoft, I think we've come to realize that we're not going to be able to do this ourselves. So our role is to enable our partners in the ecosystem to be able to help accomplish their goals. And those goals are oftentimes in the context of helping to understand and how all that information that's coming in can be better organized, how we can better analyze that, and then we can build predictive analytics and AI algorithms that will then work into the clinical workflows for both the clinicians as well as the individuals and patients and consumers. And that whole process of creating an end-to-end solution and a platform is not something that one company can do. It has to be done in a collaborative manner, in accordance with the existing standards, and it has to be done with the latest technologies.
Liz, do you mind if I jump on that? I want to respond to really sort of thoughtful comments from Bakul and David to sort of underscore, I think, my hope for the digitization of healthcare, which is the system that we currently have is a sick care system, right? It's defined by that moment when a patient presents at the door of the clinic, sick, with symptoms, oftentimes quite advanced, sometimes catastrophic, and oftentimes very expensive. When you talk about, Bakul, and I love that you push the numbers on this, the sort of traffic that Google gets, and it was actually Microsoft researchers. Here's a sort of crazy research story for you, which is they were able to find that through nothing other than internet searches, with 99% specificity, they were able to create an algorithm to detect early-stage pancreatic cancer patients. If you don't catch pancreatic cancer early, you will die. And so this is the power of this kind of technology and the reach you guys have, the data that you guys have, and your ability to process algorithms on this. It's to fundamentally reimagine what healthcare actually is. Can we move it out of the clinic? Can we move it upstream? And that's not to say that we don't need brilliant clinicians and we don't need treatments and we don't need workflows, but can we capture so much more early so that we can minimize your risk of you getting sick in the first place? And then we can also capture those moments, and intervene early. That, to me, is the bit where I think big tech are the only people who have that kind of scale to drive that kind of transformation.
And Han, I'm going to bring you in one moment, but I actually want to stay on this point for just one extra beat here. Pulling care upstream, having not just a sick care system, has been in discussion for such a long time. And it has been such a challenge, and it's often boiled down to a challenge of incentives, right? I'm not telling anybody on this stage something they don't already know. But I'm curious, just does anything spark in terms of how big tech might be able to end run around some of the incentives that health care proper, so health systems, health plans are locked into in a way that big tech may be able to get around? I think of the ability for me when I have something going wrong to search. That's something that can work into the broader ecosystem and value of Google. Are there any other thoughts that occur?
Just I was going to say that jumping off from Jen, sick care is is what we have today. The current payment mechanisms is what we have today. I think if we were to really digitize and really talk about beyond sick care, or even prior to sick care, making it more upstream, I think we need to start thinking about what incentivizes people to be motivated. I think you start thinking about the entire wearables industry, which is here, is driving towards that motivation part, right? And you're now combining, I've seen people combining it with CBT, cognitive behavioral therapies, and other sort of things. This entire world of digital therapeutics are sort of emerging. And that's sort of where we can embed technology and enable individuals to be aware of their own health conditions. Like if you start thinking about, and I don't know the exact numbers, and I've been sort of looking for this, is if you look at all the wearables that now have ECG, AFib detection, and that entire ecosystem that's been enabling people to get something on their own without actually waiting for an appointment to happen, which may happen a month later when the event actually happened, etc. That is where the shift is happening. So I don't know if we are completely not doing things, but we are doing things, but I feel like there's this tolerance for the population that at large is getting better at understanding what this technology means in part of their health, right? When a wearable nudges you to stand up after sitting for a couple hours, or it says, oh, this hour you have to walk 250 steps. Those are all the thing that big tech can sort of insert into your daily life, because it's no longer tagged as health, or health care, so to speak, in a traditional way. And people will shell out $200 for their wearables. But you ask them to shell out $200 for a care from a health perspective, it's really hard for them to grapple that. So it's a really interesting social engineering sort of challenge.
And Liz, you're absolutely right about the payment mechanisms and the sorts of incentives that's generated. And hopefully we have time for some questions, and David and Han, of course, as clinicians, you'll have thoughts about this. But I look at things like supply chain costs, and I look at things like the clinician shortage crisis. It's unclear to me that we can just keep pulling that fee-for-service lever. Who is going to bill for these encounters? There aren't enough family care providers. There aren't enough cardiologists. We have hospitals that are full because we can't discharge patients because there aren't enough skilled nursing facilities. We need to think differently. There's going to be a moment where the whole thing grinds to a halt. My hope is that we have the good sense to actually make some of these adjustments and leverage the power of these technologies before it does, because our industry actually exists to care for people. But I almost think that we're at a point of, and all right, I'm on stage, I can be dramatic, I think that's the point. But, that we are approaching a moment of crisis where for so long those financial incentives have prevented the kind of, transformational change we've needed, but we're running out of options. Who is going to do the billing? If the fear has always been we're going to keep charging and we're going to keep charging, who is going to do the charging? There aren't enough clinicians, there aren't enough nurses. We can't keep facilities in rural areas open. There has to be another plan.
Han, I would like to jump to you. So and I should share with you, this crowd, we did ask the audience to introduce themselves as well. We do have a few from big tech, a few from the entrepreneurial community, and then a lot of folks from the healthcare industry. But would love to just hear, so you're in a new role at Samsung, what are you excited about, and what do you see as sort of Samsung's role? I know we were just talking about wearables. I'm sure that sparks some for you. What's Samsung's role in this moment for healthcare?
Yeah, I am very passionate, and I've been convicted about, our Hippocratic Oath, one, that do no harm first, right? And I think the technology has so much power, and if you look at, what was the movie, Social Dilemma, gives you a glimpse of when the tools are used incorrectly, or if the business model's perverse incentives in such a way that the tools have a negative impact on our families and our kids to be more separated. I think personally, I feel very strongly about big techs having a responsibility and accountability towards using the tools correctly, especially as a platform enabler. And I can get into that more deeply, but to your question about what's our role, As David said correctly, even though we have billions of devices out there in the world, we will not do this on our own. So I think we are absolutely looking at entrepreneurs and other innovators, partners like Kaiser Permanente that we're working with. So I think it's definitely an ecosystem play. The way, I guess one area that, or two things I would say. One is, I believe that the fragmentation of healthcare is one of the major issues that can be solved through technology. And what I mean by that is if you look at advances in digital biomarkers, digital therapeutics, you're now beginning to have pieces and parts that prevented the virtual health value chain to be connected. We could do wellness through wearables, and the wearables are getting better, obviously, but I think we now, the users are expecting much more than, hey, did I sleep well? They're expecting, what are you gonna do for me? And what does it mean for me personally, not how do I get sleep hygiene, right? That's not a meaningful insight. And so I think we're moving from telling you where things are to what can be done. And so I'm really excited about the big tech's role in connecting those pieces and parts of the value chain that are traditionally in the silos and bring that together in a meaningful way. And what that means is that Samsung will not necessarily develop every single solution in the verticals, that we will likely look at really experts and people that are passionate in the space, whether it's sleep or whether it's AFib or congestive heart failure. So, I think for me, that's the challenge for us as big techs is to how do we enable not just more innovation, but actually try to address the issue of fragmentation through creation of ecosystem and a value chain in such a way that the platform enables a seamless experience and not what the consumers are facing today. The second thing I would say that I'm really excited about is, healthcare is definitely moving toward the home. There's no question that every big tech is looking at home as a target. And given the workforce shortage, given all the major trends, it's very clear that the next battlefront for healthcare is going to be in the home. But what's interesting about the home is that it is a blend of life and health. As Bakul said, this is not about healthcare here and life here. This is a kind of a composite in ways that are very different than in a hospital or clinic setting. In a clinic setting, we have a very discrete workflow. Yeah, it varies a little bit, but really there's a set series of things that we know how to do, control the process, document, prescribe, diagnose, all that. But in the home, I think we have an opportunity and both a challenge also of understanding what's happening in the home, in the last mile of healthcare. And so we at Samsung, because of our devices, because of our presence, we're very excited about what we can do with that. We have smart things that actually connect these devices and other tools that we are no longer about devices that just are refrigerators, but these are connected devices. And so my vision is connected devices, connected people, connected care.
And it's interesting because it goes back to something you were saying, Bakul, in terms of Google thinking about search and YouTube and some of the places that we go to understand what's going on with us. Who knows better than Samsung just what's going on in our homes, right? You are the devices in most of our homes, and you have the teams who think about that and think about how consumers make those decisions. So really interesting.
I was gonna just pull a thread, right? I think the one thing you're hearing consistently is like big tech brings platforms to the table, and when we bring platforms to the table, it's like naturally enables others to sort of do equal things on that platform, right? So I just reminded me, Han, when you were speaking, reminded me of one of the examples where I got really excited personally when Google actually put out this open source chest X-ray model on AI that enables, like it was trained to a certain degree, and after that, people can take that model from an open source and use a smaller amount of data to actually do their specific indications for use. And that was exciting because those kind of things, and that's just one example to just show that big tech can also be that seed in technology and innovation, and that can enable others to sort of think about, oh, I can do lung nodule detection but starting from a place that's already been curated for you, right? So I feel like that's sort of the power of big tech to do that, enabling platforms for other people.
In addition to the platforms, I'd say the tools that are necessary to be able to develop and advance some of the capabilities. If you look at where all this data is coming from different sources, we can all recognize that there's value in it, but it's very difficult for a human, specifically a clinician or a consumer, to be able to ingest all of that and make sense out of it, whether they be patterns, whether they be looking at disparate sources and trying to figure out what's the hidden gem behind that. But computers can. And we have seen this again and again, and it's advanced our ability to have medical discoveries. It's helped us be able to draw insights where we looked across large populations rather than just a particular individual. It's allowed us to be able to then go back and make individualized recommendations for specific people. And that's the opportunity for us to be able to start thinking about how within the platform and the tools that there's opportunity for innovators, for companies to be able to build off of it. And that's where all the innovation is going to come from the opportunity to be able to share on common platforms using the same standards, using the latest advancements on the technology.
And if I can just build on sort of both of these points a little bit, this idea that we have far greater insights, right? And we have these platforms when we can kind of like aggregate these data, these findings that have been invisible to us before, and then we have the capabilities of sort of interpreting what they mean. I think that's excellent. I think the piece where, and I want you guys to correct me if you think I'm misspeaking here, but there's a third piece that's actually needed, which is, for example, I know I don't sleep enough, and I'm like, it's a decision. And we know this about lifestyle choices generally, right? Should I have that second glass of wine on a Tuesday? Maybe not, but I do. And these are the sorts of, at a much more sort of imperative level, we need to turn those insights then into action, right? And I think one of the things that big tech does very well, Ahan, you had the example of sort of social media, so in some cases to our detriment, but we're quite good at behavioral change and nudges and all of these sorts of things. And there are going to be places where we need clinicians to intervene. 100%, we're not looking to replace them. But I think there's also a lot of moments where it's not just our capability of sort of aggregating these findings and creating these platforms, or the capability to interpret them in a trustworthy way, but it's actually getting to action, right? A lot of us know that some of our choices aren't the best. What can we actually do?
Yeah, no, I'm really glad that you pointed that out. And, as a physician, even if I'm 100% perfect in my diagnostic and treatment modality, I'm still only 20, 30% into the outcome of that patient, because it's really humbling as a physician after so many years of training to realize that whether patient decides to take the medication or decides to be compliant on whatever exercise or whatever instruction that I give them. And so I think in my role, what I've told my team is exactly that, is I think we've done a good job of giving them data and maybe a little bit of insights. What we haven't really done well, and I would say this is true for all big techs, is embedding the art of medicine or the social science or behavioral science into the design. And so I would argue, just as the social dilemma showed how it can be used incorrectly, we probably could sit together as big techs and really think about what does care by design look like in a software that essentially addresses this issue of last mile of how do you get the person to change towards a more positive behavior. And in the work that we've done with IDEO and a number of others, I think it's very clear that it is really the combination of wearables and other sensors that will give us these snapshots and windows of opportunities of when the patient is willing to change. These windows only come at a periodic, episodic way. And when those moments of crisis or moments of challenges occur in our lives, we are more ready. We're ready to be willing to change because the value is clear. And I think if we can detect those changes, but then include the science of how do I help you change your behavior even though it's harder, can we make it easier? Can we make it more fun? Can we make it more sustainable? So I think there's a lot of work that we as big techs need to do, but I think really we're no longer considering engagement of MAUs as the goal. It's not. It doesn't mean anything. What really the end goal we're seeking is positive, healthy behavior.
I just want to add one other thing that we have learned over the past decade is that while individual behavior is something that we think we might be able to impact through technology or through information, largely there are other factors that drive one's decision making, and these factors are socioeconomic, they are environmental, they are things that need to be addressed at a societal level, at a community-based level. And so, one of the things that big tech, I think, has an opportunity to be able to help is that in working with organizations that are outside of your traditional healthcare boundaries, finding ways that you can bring those organizations into the mix, allowing those data sets to be much more usable, interoperable. That's an opportunity for us to be able to start addressing some of those bigger challenges, because ultimately it may not be that I may want to have better diabetes care, but I may not have the capabilities to do so unless some of these barriers are removed.
It's, I think we've known from a public health perspective for quite some time that information and education are certainly important, but are rarely the key to behavior change. I think what's exciting about this group, and certainly the organizations that you represent starting to talk about that, is Google, Microsoft, Samsung have become some of the main drivers of our behavior, right? Because you have thoughtful folks who think about consumer products, who think about just sort of how do we get folks to use, enjoy, and really start to rely on these products. And it's that kind of expertise that with your thinking of, right, okay, fantastic, now for health, now for clinical care, is powerful. And David, you've mentioned a couple of times here just this community thinking and the partnered thinking that Microsoft has been doing. I'm curious just if you could give us a little bit more of an example or a little bit more color around how Microsoft has been partnering with health system or health plan, if there's one that comes to mind that would give us just some color of how that's been working.
I'll start with the pandemic. We all know that during the pandemic, every organization across the world was paralyzed. Every individual and every family was. And what we were paralyzed with was lack of information and an ability to be able to help understand whether or not these new interventions that we proposed, such as vaccines, were things that we wanted to take. And what we started realizing is that working at the global level, working in collaboration with the World Health Organization, working in collaboration with governments in countries, and then going down to the state level and local communities, that the fragmentation within the healthcare system was pretty stark, where there was a lot of resources initially invested up front, but when you start pushing this information and the resources down to the local level, that's when it became extremely difficult to coordinate care. And the success that we were able to achieve came about not just simply by making vaccines available and making information available, but it came about through public-private partnerships driven at the community-based level, in which three parties in particular, community-based organizations, like faith-based organizations, nonprofits, organizations that currently work in communities, particularly in underserved communities. So we're talking about communities that may be disenfranchised. We're talking migrant farm workers, we're talking about individuals that don't have health care, but connecting them with public health and health care. And it was really interesting because that combination of creating an interoperable data exchange that allowed us to be able to have vaccine information that was captured securely be brought to immunization registries, be able to manage through the public health system, but with resources provided through healthcare, is a sustainable model. And that is something we are now starting to look at as we start thinking about, like, what is it that needs to be done if we want to address health equity at the very local level. Let's talk about what are the tools, resources, and opportunities to be able to empower community-based organizations so that they can work in collaboration with their partners, healthcare, and public health.
And so Microsoft's role in that example of the vaccines that you were just giving was to understand sort of the needed information that for folks to share and start to set up that system. Can you just talk a little bit about how that actually came to be?
As everything, the pandemic was a constantly evolving scenario. So the first need was around information. So the the interesting innovation was taking a chatbot and converting that into a COVID vaccine question chatbot. So anyone that could ask a question, it wasn't just about information, but it was about, I have a specific scenario. I have a fever. I just recently returned from a trip where I may have been exposed, and I've got young children at home, and I've got seniors. So like these are the questions that people had. They didn't want to know, give me the guidelines. They want to know, in my scenario, what would you recommend? And because a lot of people didn't have that answer, they immediately went to the ERs and the urgent care centers, and we saw a massive flooding of them, and people that needed to be seen were not being seen because of that. So it became a major crisis led by the fact that there wasn't the right information at the right time for individuals. So that was deployed, CDC deployed it, you name it, across the world, and it had tremendous success. Organizations saw that the foot traffic into these states went down dramatically. They were able to connect to virtual care solutions. And that was sort of, I'll call challenge one. But then very quickly, it became around enabling an efficient process so that you could identify when the individuals and organizations had sufficient PPE, had ventilators. And so now this was about data interoperability between hospitals within the local regions. And so that was another technology challenge. And then the next challenge was around supply chain. And then the next challenge was around the vaccine deployment and registration and scheduling. And almost in every scenario, we realized that technology was an enabler. It wasn't the answer, but it certainly helped make things better.
Incredible. And we're getting the flag. This time has flown for us. Hopefully you're not all asleep out there. Again, I can't see you, so okay, you're giggling, you're alive, good. So I think I would love just a little bit of a rapid fire, Bakul, starting with you. When you look forward 10 years, there's always the likelihood that we overestimate that what will happen in short term, underestimate in the long term, the famous Bill Gates insight. I'm curious, when you think in that slightly longer term of 10 years, what is it that you think we are underestimating about what really can happen in the digital transformation of healthcare?
The question is underestimating, right? Not overestimating. It's interesting. I think we're underestimating the power of technology and perhaps even, I would say, how much technology be enabling individuals. And when I say that, let me just wrap it up with one thing, is our general population's knowledge of how they're using technology in their health is, I feel like it'll be underestimated. I think we are at a very, very high curve of learning that's happening. I think you can see the population as they grow into this enabled technology, sort of enabled sort of environment. I feel like we will be underestimating what expectations people are going to have from technology.
Jen?
Well, for anyone who knows me, I don't think I've underestimated anything in my life. But I think your point is well made. And because of the backdrop that we've discussed throughout the course of the conversation and the proven success that our colleagues in tech have in other arenas, I really think we can bring this to bear in healthcare to really reimagine what it means to care for somebody. That we aren't waiting for them to come to us sick, and we really have moved healthcare upstream, and we are thinking about defining a good healthcare system as being one that keeps people healthy and out of the clinic as much as humanly possible, as opposed to how good are we at treating them once we get sick. I really think that that is possible within the next 10 years.
So I personally underestimated how long it would take me to stand in the line to get my badge for CES. But from the healthcare perspective, I absolutely think artificial intelligence is something that we have just skimmed the surface of what's possible. The ability for us to be able to take unstructured forms of data, voice, text, image, and text, and convert that into forms that we can use in a clinical workflow manner, that is going to be a game changer. Now, on the flip side is we've underestimated how difficult it is to be able to start, develop, and manage this. Because it's no longer that you can just simply create an algorithm, validate it, and then assume it's going to work for every single person in the world. We're recognizing that as you start building in these technologies, it's the subpopulations that matter. And how do you then validate? that this is actually working in every subpopulation. This is the challenge that we run into. We've created now an opportunity to do some amazing things, but with that, there's a whole new set of responsibilities that we're going to have to start recognizing that we have to put governance in place, policies, and we have to make sure that we do this responsibly.
And Han, last word.
Yeah, I think I underestimated the time for arrival for the panel, number one. But on a serious note, I think we are underestimating how hard the last mile is. As David mentioned, we have the social determinants of health. We have the behavioral science aspect. There's the human care component in that last mile. And I think home is going to be very challenging. There's just no question. And I think that the tools I'm very excited about, the implication and what we can do, like AI, as David mentioned. But I think the big techs probably would have to come together and compete on many things, but really share in some things that will help us to accelerate, because I think the problems that we are facing are monumental, but worthy. And so I'm excited about the people. Every time I go around the booth, I see entrepreneurs, people that are passionate about a specific problem. And as big techs, I think we have the scale and potentially the platform and the wherewithal to really enable you guys to do some amazing things. So I'm really excited about that.
All right. Well, thank you all for sharing your insights of where your organizations are at, and thank you all for being with us. The next panel will start at 11, but please join me in thanking this panel.